Will tell your nervous system and your brain and your body where you are going and which way is up. So it's really important.
Hey everybody, Dr. Perry from Stop Chasing Pain. I want to give you some fair warning here. This video is probably going to melt your brain and explode some brain cells, but in a good way. It's going to be challenging where I'm going to take you down the rabbit hole of some neurology, teaching you about the VOR, the vestibulo-ocular reflex. That's learning how the vestibular system, the inner ear, and the eyes and the cerebellum and the back of the brain that controls accuracy, balance, and coordination of movement all work together when you fix your eyes on a central target and you move your head in different directions without taking your eyes off the target. There is so much stuff happening in your brain and your body with that. It's crazy. Now, why is this important for you? Well, because this can really help you if you have chronic pain that's just not going away, athletic performance that needs a jolt, okay? Sticking in just some things that you can't quite figure out. Now, I'll be honest with you. You could just start moving your head in different directions and focus on a target, and it's going to help you, but I want you to understand what's going on in there because it's really cool to understand your body. If you're a healthcare professional, this is definitely going to be up your alley, but if you're also just a regular person who wants to learn more about their body, feel better, move better, this is it. This is for you. I think you're really going to enjoy it, watch it like a lot of times, okay? And please make sure you hit that subscribe button so you never miss any future episodes coming on up. I am so grateful and thankful and appreciative of you that you choose to learn with Stop Chasing Pain on our videos. Thank you so much. Let's move right on into the video.
All right, everybody. Next video. This is where we're going to talk about the vestibular-ocular reflex. This is an absolute powerhouse, kind of like everything else. I'm going to make this a little bit bigger. Okay, the idea behind this one is where we're going to fixate on a point in front of you, right? Then you're going to actually move your head, but keep your eyes fixated on the spot. It's much more challenging than it looks. This is going to significantly stimulate your vestibular system, which is your inner ear. So if you remember, that's the system inside the ears on both sides that will tell your nervous system and your brain and your body where you are going and which way is up. So it's really important. We're going to stimulate the cerebellum that sits in the back of the skull here. You have left cerebellum, you have the right cerebellum. And depending on where you're moving your head, where you're turning your eyes, and which vestibular system you're stimulating, you'll stimulate more of the cerebellum on a particular side. Okay, and the cerebellum controls accuracy, balance, and coordination of your movement. So the left side cerebellum is really going to drive stuff on the left-hand side, how well I move my left hand, and the right one's really going to drive the right side over here. Why does that matter for you? Well, I mean, maybe you have issues of pain, discomfort, lack of coordination on one side of the body compared to the other, and you need to do a little bit of the cerebellar work. Well, you can do that through moving your eyes and through moving your head, okay? For instance, like the ability to stand on one leg, called a single leg stance, you might notice a big change in that. Why is single leg stance important? Because that's pretty much what walking is. Every time you take a step, most of the time you're spinning it on one leg at a time. And when you're running, every single bit of your time is on one leg. So this work is really, really critical for anybody who is into running. I'm going to get back into the share screen now. Right? And we're going to start to go over this chart. Okay. This is the one, I'll be honest with you, where your brain will kind of turn yellow. All right. You just have to keep at it. You just have to keep practicing. You just have to watch it over and over and over and go through the movements until it makes sense. All right. But let's get back to this in a moment. Let's review the vestibular system. Okay. Remember, the vestibular system is that inner ear apparatus, and you have what's called saccules, utricles, and semicircular canals. The ones we're really going to be paying attention to when we do the VOR are the semicircular canals. The saccules are the ones that are concerned with vertical movement. That's up and down like you're riding an elevator. You'll stimulate that a lot if you do rebounding, jumping up and down on a little trampoline. You'll also do it when you do squats, going up and down on a squat. I've actually seen people who struggle with squatting because as soon as they go down, they engage a saccule system that has some issues with it. Then you have the utricles that are horizontal, almost like riding in a car, right? Linear horizontal, that way you're riding in a car. People who get like car sick sometimes have utricle issues, all right? And then you have the semicircular canals, and the semicircular canals are more angular. That's the yes thing where you bring your head forward and back like yes. It's also going to be the no. That's going to be the horizontal canals, and it's also angles. Bringing your chin towards a collarbone, bringing your chin away from a collarbone like this, looking down towards your feet on one side, then looking up towards the sky on another, all right? They're going to come into play. And like we said before, your cerebellum is going to play a role. All right, we have to go over this piece by piece. What I want you to notice is this. Okay, first thing you see here, when you see right posterior canal, right anterior canal, right horizontal canal, that's your vestibular system on the right side. So whenever you stimulate that, you're really going to put a lot of input into the right cerebellum. So what do you think you're going to influence a lot here? Your right side. Now, look at the other side. Left posterior canal, left anterior canal, left horizontal canal. That's just the position of where they are. Well, that's left side cerebellum. Right? Don't pay attention to the eye stuff at the bottom yet. If you jump ahead to that, you're going to get lost. What I want you to notice at the top here is that you're going to move your neck, but the eyes stay straight. That's why we have this. You're going to lock on to something like an A here. And this is a chart that we use to do the VORs when we work with people. But you can also, like I said, stare straight into the camera lens when we're doing it here. So I'm going to go towards the right side first. And the reason I do that is because that's how I started to wrap my head around learning these things. So I kind of always go back to it to make sure that I get it right. And I'm going to tell you right now, I can't promise you that I'm not going to mess this up as I'm going. So I may have to second guess myself as I go through. That's just how learning is, right? So we're going to concentrate on this right side first, right? So remember, forget the eyes for now. So look here. The right horizontal canal. So it's going to be on the right side and it's horizontal. The way that you're going to stimulate that is to rotate your head to the right, right? So if I'm looking straight ahead and I pick a solid point, I'm looking at the camera. If I turn my head to the right, that's the right horizontal canal. Now, it doesn't even matter where I'm looking at that standpoint. As long as I turn my head to the right, that's the right horizontal canal. Okay? Like I can look to the right and still turn to the right, and I'll still stimulate the right horizontal canal, which starts to stimulate the right cerebellum. Okay? So that's a horizontal canal. Now you have a posterior canal. Posterior means what? More towards the back. Anterior means more towards the front. Okay. So when we do these, I want you to think about a few places on your head. So if I look in the front here, I got the center of my skull, I got the right side here, right? And then I've got the back posterior corner here. That way, right? And you're also, when we start to do this thing, I want you to imagine when we go along that your nose is like a pencil. So when you use your nose, and I'm like tracing imaginary lines, When I trace the lines with my nose, what else is moving? My chin and my head. So a lot of people say, oh, it's really easy for me to get this if I imagine that my nose is a pencil. You can use that too. We'll kind of show you both as we go along. Let's get back towards here. Okay. So that's the right horizontal canal, right? Now, how do you think you would stimulate the left horizontal canal or the left cerebellum? What do you think you would do? Well, you rotate your head to the left, right? Or correct. Looking here. And if I'm looking straight ahead, I turn my head to my left. That stimulates the left horizontal vestibular canal and the left cerebellum. Or I could just do this. Got it? Now, next one. Let's go right posterior canal first. Okay. So right side posterior in the back. Now, the easiest way you can start to find out where this is I'm going to guide you to the end point, and then we're going to combine them, right? So when you're first learning this is the easiest way to do it. You're going to rotate your head to the right and then extend your head backwards. Here's what you're going to do. You're going to rotate your head to the right and then extend your head backwards. And then what do you see? Like this back corner of my head here is going towards where? The right shoulder. Just like that. Right? Just like this. And where's my nose going? It's going up and to the right. Up and to the right. Don't worry about the eyes for now. Okay? That's where it is. Now, to get to that point directly, I want you to combine those two movements and split them in half. What do I mean by that? I want you to try to bring the right back of your skull to the back of the shoulder here like this. So my nose goes up and to the right. That's a combination of what? Turn to the right and bend backwards. That's where you want to be. Now mix those together so you do it in one straight shot. Like this. Just like that. Now, if I was following a line with my nose, here's the nose in the center, that line would go where? It would follow the line up to the right. It would follow the line up to the right. If I go back to here, that's this. See this right here? I would follow that line up to the right with my nose. So why don't you try that? Okay, and look at the A, and then I want you to trace this line with your nose. Just like that. Up. All right? That's the right posterior canal. And if I stimulate the right posterior canal, I'm also going to stimulate what? The right side cerebellum. Right? So everything's driving into the right. Now, let's stay on the right this time. What if I want to work the right anterior canal, like in the front? Okay. I'm going to be envisioning this part of my head coming forward, and then my nose now going not up to the right, but down to the left. Down to the left. So this one, my chin goes up. Here, my chin goes down. My chin goes up. My chin goes down. My nose goes up. My nose goes down. And how you get there is this. What's the combination? I'm going to help you find it. Because many people, I'm going to tell you right now, many people struggle to do that movement smoothly. So I help them break it up. The right anterior canal. So I'm in the center here. Look at my mouse. I'm on the right anterior canal. Here's what I want you to do. You're going to, when I go big on the screen, you're going to rotate your head to the left and then flex it forward. You're going to rotate your head to the left and you're going to flex it forward, all right, as you're looking straight ahead. Now, let me get this down. So, rotate to the left and flex forward. That's exactly where I was. Now, I want you to try to get to that spot without turning and flexing. They come together. Down, up, down, up, down, up, down, up. So if I'm following along now with my share screen, let's go back. I'm going to follow this line right here with my nose pencil, right? Just like that. That makes sense. So it's down to the left and up, down to the left and up. And eventually what you're going to see is you can mix those two together. So I can go up to the right, down to the left, up to the right, down to the left, right? Up to the right, down to the left. And that looks like this. I'm going to look straight ahead, go up to the right, and I'm going to go where? Down to the left. Up to the right, see it? Down to the left. And when you do that, you're stimulating the right vestibular system, influencing the right cerebellum, changing big time movement in how you move your shoulder, your hip, your foot, your ankle, your knee, blah, blah, blah. You got it? Then we're just going to do the same thing to the other side. All right? So let's go back to it. This one we just did a right horizontal canal. We did a right posterior canal. We did right anterior canal. And if you remember, I already showed you left horizontal canal early on because there's the easiest ones to do. Now let's look at left posterior canal. We're going to rotate our head to the left and then extend it. That means bend it backwards. So it looks like this when you do that movement. Okay. Look straight ahead. I'm going to rotate to the left and then I'm going to bend my head back. Now look where my nose pencil is. It's up to the left and I'm looking straight ahead. Forget the eyes for now. Okay. And then I'm going to come back down. Now mix those two together. Up and to the left and back. Up and to the left and back. Up and to the left and then back. What you're going to find is that many people are just, they're all over the place. They have no freaking idea how to do any of it. They're just so disconnected from the eyes to the cervical spine to the vestibular system, and they're just all over the map. That's a big thing to know, everybody, because when you struggle with that, your body is paying the price somewhere in your musculoskeletal system with compensations, adaptations, and excessive tensions and tightness along these fascial guy wires that are just trying to hold you together. All right? Now let's go back. So we went left posterior canal. So what happens here is you're going to go with your nose tracer up and to the left, up and to the left, up and to the left. Okay. Now, if you want to do the left anterior canal, that's in front, you're going to trace your nose pencil down to the right. From the center, no, down to the right, and down to the right. How do you get there? Well, let's see. Now we're on the left anterior canal. You rotate your head to the right and then flex it forward. You rotate to the right and flex it forward. But let's do it together. Look straight ahead, rotate your head to the right and flex it forward. So you see how this part of your head is coming down that way and your nose is down to the right and your eyes are straight. Okay. Then just come back up. Let's do it again. Rotate to the right. Bend your head forward. That's where you want to end. Now I want you to try to do those together. But look, nose pencil goes down to the right and back up. Down to the right and back up. Down to the right and back up. trying to look straight ahead. One side will be much more difficult than the other. Now, if you want to mix them, left anterior canal, left posterior canal, your chin's going to go down to the right and up to the left, down to the right. That's anterior, posterior, anterior, posterior. On the left, imagine the line like this, going diagonal, and use your pencil. No, nose goes down to the right, nose goes up to the left, nose go down to the right, nose up to the left, down to the right, up to the left. Now you're firing the left side cerebellum to get stuff on this side. Okay? That makes sense. Is everybody with me? Okay. Breathe. Take a breath. Take a moment. Okay. Now we have to go to the eyes part. This is the one that confuses people the most, but that's okay. You'll get it. I know I've said that 1,000 times, but it's true. Stay with me. If you are looking straight ahead at something, let's say you're looking at the A on that chart or you're looking at the camera lens, your eyes are going to fixate on that spot, right? Your eyes are going to fixate on that spot here. That's gaze stabilization, burning a hole into that lens, right? But watch what happens when I turn my head to the left. Look at my eyes, okay? Look at my eyes. If I turn my head to the left, where are my eyes now going? The right one is actually looking towards the right, yeah? And the left one is looking towards the right. And they moved to the right, but I didn't move my eyes. They moved to the right relative to me moving the head. But to your brain, it's kind of the same thing. So when you look straight ahead and you turn your head left, your brain senses that you're looking right because you are. All right? Because you are. But when your head goes left, if I'm rotating to the left, I'm stimulating what canal? The left, because I'm turning to the left horizontal canal. Now, where are my eyes looking? To the right. Okay? So what that means is this, everybody. When your eyes look right, you're actually stimulating your left horizontal canal and your left side cerebellum. So when I turn my head to the left and my eyes go right, boom, everything on this side is going. Now, hold on. If I go back to the center, now I'm not going to move my head, but I'm going to move my eyes. So now I'm going to look right. So as soon as you look right, you still stimulate the left side cerebellum and the left horizontal canal of your vestibular system, even though you're looking right. And when you look right, what muscles are you using when you look right? On your right eye, you're using the lateral rectus because this right eye is going lateral. And on the inside eye, you're using your medial rectus because you're looking in that way. So when we check your vision early on, your movement of your eyes early on, and we do that H pattern. Remember the H where you go right and then you go left? There's way more going on than your eyes, right? What did you just stimulate? Your vestibular system and your cerebellum, just when you did that, and you really put in a huge load into your nervous system, autonomic system, conscious, subconscious system, and emotions. Okay? That's why the VOR is so incredibly powerful. Now, let's try the other way. Right? This one, we were looking straight ahead, and we turned our head to the left, and the eyes went where? Well, they went to the right. See how I got a corner here and I got a corner here? Now you're going to rotate your head to the right, look straight ahead. Where do the eyes go? Left. So when I turn my head to the right, I'm stimulating what? The right horizontal canal, the right vestibular system, the right cerebellum, and my eyes are looking left. So what that means is this: every time you look with your eyes to the left, you stimulate the right side cerebellum and the right side horizontal canal. And you can see that on this chart. So I've got where they go. So look, if you're looking straight ahead and you lock onto something, if you turn to the right, okay, if you rotate to the right, remember neck moves, the eyes look left. If my left horizontal canal, I'm going to turn to the left and my eyes go right. Got it? Easy peasy. Now the jambalaya soup, the ones for the corners. All right. Do you remember the ones from the corners? Why they're so important? Looking up to the right and down to the left. Up to the right and down to the left. We're working the what? Inferior obliques and the superior obliques, as well as your recti muscles. But when you get to the superior oblique and the inferior oblique, they are big, big drivers for, in my world, your autonomic nervous system. That's fight or flight. Okay? So I'm going to try to explain this as best we can. Let me show it to you first before I start to try to explain it with this one, because it's a lot more difficult. Now watch. Take this off. Watch me first. If I'm looking straight ahead at a target, I'm going to work the right posterior canal. How do I work the right posterior canal? I would turn my head to the right and tilt my head backwards. Yeah. I will go here and go backwards, or I would mix the two together, and then I'm going to take my nose pencil up to the right. But if I'm looking straight ahead when I do that, where do my eyes go? You see my left eye? Where is it looking? Down into the left. Down into the left. Where's my right eye looking? Down into the left. Yeah? Now, do you remember what muscles those are? When the eye is in abduction away from the nose, the rectus muscles have the advantage. So on this side is the inferior rectus. And on this side, remember, if something is in adduction in towards the nose and it's looking diagonal, it's the superior oblique, which does the opposite motion. So superior actually drives inferior. So when I tilt my head back to the right, my eyes go down to the left. That's the left inferior rectus, the right superior oblique. And it's just like if I did this. If I'm looking straight ahead and I don't turn my head, but I look down to the left. Just like that. When you look down to the left just with your eyes, you stimulated what? Your right posterior canal and your right cerebellum, and you influenced this right side of the body just by looking down to your left. Okay? So it's here. Now, this is the easier part. This is the easier part. If you are diagonal back here and you have your nose pencil up to the right, okay, my eyes are looking down to the left. Now, if I follow my nose pencil down and I keep looking straight ahead, where do my eyes go? They go up to the right. So all you have to know is just one. If your eyes are down to the left on one canal in the back, if you go forward, your eyes are up and to the right. They're going the opposite direction. Down to the left, up to the right. So now when I come down, remember this one, this is what? The right anterior canal. The right anterior canal goes with eyes looking up to the right. Okay? That's why when you do this pattern, watch here. Okay? Is your brain numb yet or what? If I do this, now when the eyes go down and then eyes go down to the left, eyes go up to the right. Down to the left, up to the right. Okay? And then you would just reverse that for the left side. Okay? You would just reverse that for the left side. Okay? Now that's why this right here, why this is so important when I first check someone. One of the first assessments that we're going to do is that H right here, like this, because I'm going to be able to check a lot of stuff going on there. This is another reason why people may get dizzy. They may feel nauseous. They may feel sick. They may feel very tired or fatigued just when they move their eyes. Why? Because that's a lot of neural load, everybody. I mean, that's your vestibular system coming into play. That's the cerebellum coming into play. That's your eyes coming into play. Not to mention what else? When you're moving your head, right? You remember all these things? Vestibulo-spinal reflex. Okay? It's the vestibular system is working with your spine, but you have your vestibulo what? Colic reflex, the cervical spine, working with your vestibular system yet again. The vestibular autonomic reflex, and a big one, the cervical reflexes. A lot of things happening when you move your cervical spine, your head, and your neck.
Okay, so what are some of the things that you can do with this information? All right, let's break it down. If you want to impact more stuff on the right side of the body, you do the things for that right vestibular system or right cerebellum. If you want to affect more things on the left side of your body, then you do the left side vestibular drive, left side cerebellum. So maybe you have more pain or discomfort, or you keep getting injured, for instance, like all on one side. Give it a go, see if it helps. Okay, the thing to remember with this one is it doesn't take a lot of repetitions for this thing to begin to make a difference for you. You want to be careful that you don't go too fast. You don't overload your brain and your nervous system when you do this work. So what I'm going to encourage you to do is go slow. Okay, make sure you always keep breathing. Don't hold your breath. You'll find when you struggle with some of these movements, it might be difficult to breathe. That means you need to take a break. Okay, so pick a target that you can focus on. It could even be your own thumb out in front of you, whatever you want. Keep your eyes locked onto it and just slowly move your head in those directions like we reviewed in the prior video. Now, if you'll notice, you're probably saying, hey, Doc, you didn't talk about the one going up and down, okay? The reason I didn't do that one, I still want you to go through that motion, but that's pretty straightforward. When you bend your head forward like this, you're gonna get your anterior canals, both of them. When you go backwards, you're gonna get your posterior canals, both of them. So when you do like a yes or no type thing, you're also going to be affecting the vestibular system as well, okay? And cerebellum and all that good stuff. So just make sure you go through all of them. I reviewed the angles because they get the most confusing for people.
You can also look up other resources on YouTube or Google. Just type in VOR, vestibulo-ocular reflex, and then start to study other people who teach it. because there's many, many wonderful teachers out there. I'd like for you to learn from many different styles, and you're going to see how I implement all these things for what I do and for myself and my patients that stop chasing pain. Okay. And maybe my stuff will work better for you. Maybe somebody else's things will work better for you. I don't know about you, but I mean, my brain is kind of tired and fatigued now because I've been having to show these things to you and do them and explain them. Okay. That's been a fun one, trying to get these angles for you and also making sure I get these canals and remembering them right. But you don't even really have to, honestly, to do this work. I just want you to know this, everybody. When you turn your head from side to side, or you go forward and backwards, or you bring your chin up and your chin down, and you learn to control your eyes or move your head with that, you can change your life. That's the biggest takeaway. That's the biggest takeaway. All right. Good job. Well done. Give yourself a much needed break, and we will see you at the workshop.